Good morning or afternoon. It's good to be back with y'all, or welcome new people this week who weren't able to join us yesterday. We have a real treat in store, and I am excited that Srila is not just listening today, as yesterday, but she's presenting, so we can hear all the amazing things about Brighter Bites that we have learned through all of our data collection. As I talked about yesterday, Brighter Bites came out of an idea in my household where my kids' eating habits changed dramatically just from an access to an abundance of produce. And we've recreated that here at Brighter Bites. 11 years ago, we started with one school in Houston, Texas, and now we are launching our 11th city across the country. 60 million pounds of produce and millions of nutrition education materials given out to the people in our community who need them the absolute most. But what's amazing of us Brighter Bites, if that wasn't amazing enough, because I'm really proud of the team for all of those accomplishments from coast to coast, is that we know that we are creating sustainable change, because Srila and her data team, probably butchered that name, but her team at UT School of Public Health are studying everything we do in tandem with the Brighter Bites team. And that is exciting because it's not just a feel-good program. We're actually creating communities of health through fresh food every day. So I love it. I'm excited. I bet I'm going to learn some new things today too. But before we get started with Dr. Sharma, or Srila, as I like to say, since she's one of my best friends along this journey, I'm going to turn it over to Rich Dackman, our amazing CEO, and give a snapshot of what's going on today at Brighter Bite. Thanks, Rich.
Thanks, Lisa. Good morning, everyone, and thanks for joining us. I just wanted to give you a brief picture of what we're going to be doing at Brighter Bites this coming year. Our plans are, and we fully intend to execute, to be in over 204 elementary schools, plus our summer sites in over 11 cities. And last time you heard from us, we said we were celebrating our 10th anniversary in 10 cities. So you hear 11 cities, and we're very proud to announce that we are launching our new city, which is Phoenix, Arizona, this fall. We're going to start with 6 schools in Phoenix area. Tremendous partnerships in Phoenix, and we're really proud, and we're very, very grateful for all the great partnerships that allow us to start in our new cities, including Phoenix. So across all cities, we're going to be serving approximately 35,000 families. And, as Lisa just mentioned, we're going to be doing a lot more families than that, nutrition lessons, but 35,000 families will actually be receiving our produce. And that's over 10 million pounds that we're going to be giving out at no cost to all of our families, and obviously teaching them how to eat it, changing their shopping habits, and changing their behavior, which you're going to hear about from Srila. I get to call her Srila too. Sometimes when we're being serious, I call her Dr. Sharma. Anyway, I encourage all of you to go to our homepage, our Brighter Bites homepage. There, you can actually click on a location if you would like to volunteer in one of our locations. In particular, if you're in one of our 11 cities, which it's listed if you just go to Brighter Bites, and we would love to have you as a volunteer or any type of support you would love to give us. But we're always in need of volunteers, and I can just tell you, if you go out to a Brighter Bites distribution or bagging, you will be energized for weeks to come at this amazing experience. So thanks for all the support, and we're very, very proud of what we are accomplishing, and thanks for everybody that is part of it. So I'm going to turn it back over to Lisa now.
Turns out produce is pretty fun, right, Rich? Playing with it, giving it out, sharing all that. So anyways, yes, we'd love to see your volunteers. I am constantly recruiting people, even this morning. Oh, great question, Kristen. One before I turn it over to Srila, just so you can get this in your head, she asked, what do volunteers do? Volunteers, we actually bag and box all the produce up for the families at the schools, because again, we're trying to create communities of health through fresh food. So the food is delivered in pallets and boxes of produce, and we then distribute it amongst the Brighter Bites bags, even amounts for the families. So we get this prescriptive amount that Srila and her team has come up with, this number of servings for this family of 4 that we're serving. And you, as the volunteer, get to bag with us. So you're culling those oranges, you're bagging those apples, lemons, and you might also, as I don't know if you noticed from the pictures, learn about fruits and vegetables you've never seen too. So it's kind of a fun way to work together, play with your food, and just have a really great direct impact, direct contact with the people you're serving. With that said, Srila really needs no introduction. She's so incredible. She is the brains, 100% the brains behind this organization. And I'm so pleased to have you present today. So I don't want to take any more time away from this amazing information. So take it away, Srila.
Thanks so much, Lisa, for that warm introduction. And hello, everybody. I'm Srila Sharma, and I have the privilege of being co-founder of Brighter Bites alongside Lisa, and also serve on the board of directors of Brighter Bites. And in my day job, I'm a professor of epidemiology at the University of Texas School of Public Health, which has served as the research and evaluation partner for Brighter Bites. And I see several familiar names. So while I'm here speaking on the research and evaluation that we've done, really a lot of the credit goes to the team, many of who are on this webinar today. So it's really just like the program implementation efforts are a team and a partnership. So is the research and evaluation. It doesn't happen without the incredible Brighter Bites team and leadership and the team at UT, as well as several other academic institutions that we've partnered with along the way. So I do have a few slides that I want to share, but before we jump into the data, I did want to share why the data is important. One, it's a way to document what's happened. If there is no data, then did it really happen? Second, data really provides us with an understanding of whether we're on the right path. You've heard so far yesterday about the 3 pillars of produce distribution, nutrition education, and fun food experience. And we are very defined in the formula of how much produce we want to give, 50 servings, what constitutes as Brighter Bites nutrition education and fun food experience. Well, if we are so defined, then are we implementing as planned? And if we think about food as it relates to health, then are we consistent in the dosage that we're providing? We know the impact that food has on health. And so if we think about food as medicine, then we need to think about the dosage and the adherence and all of those pieces as well. And lastly, if we are implementing as planned, then are we having an impact? One could be doing a feel-good program for a really long time without the intended impact, and that really serves nobody, especially not the community. And we are then also not being good stewards of the resources that we've been trusted with. So we are very proud of the data backbone that we've built over the past decade. And it's important I will add that from even a research perspective, but more so from a advocacy perspective, that publishing this data is important. So future work can build on existing science. We don't have to then reinvent the wheel. And I'm proud to say that through the work that we've done thus far, we have over 22 peer-reviewed publications with the Brighter Bites data and counting. And as I mentioned earlier, UT Health School of Public Health has really served as the core research and evaluation team. And also we've trained over 100, it's unbelievable, but we've trained over 100 students, undergrads, public health students, medical school students along the way. as part of our efforts. And so if there's a lot of training that's happening through BrightBytes as well in building that next generation of public health professionals. So going back to the three components of BrightBytes, I'm going to go ahead and share my screen. Let's see if I can do this. Okay. Nope. Okay, can y'all, I'm hoping everybody can see my screen. So as I mentioned, a few minutes ago, with BrightBytes, our mission is to create communities of health through fresh food. But we have an alternative mission, which is to be data-driven, to collect evidence, to inform program and advocacy. And we're really focused, very laser focused on two pieces. Are we implementing the program as planned? And if we are, then are we having an impact? And to answer the very first question, are we implementing as planned? We have really built out a robust data backbone so that we are collecting information in real time from each and every one of our schools. And when I say each and every one of our schools, if you ask me today, what is going on at Sherman Elementary in regards to program implementation, we can provide you in real time how many families attended, what produce they got, what was the variety of produce they received, and who didn't come, and what were some of the metrics around the dosage, the reach, and the fidelity at each of the sites. And this information is not just available to me and the data team, it's available to every single one of BrightBytes staff. And that's really to help them troubleshoot and address many of the concerns that they may be having in real time. As Rich mentioned, we are now in 11 cities serving, hundreds of thousands of families each week after week. And this is a deep dive, right? Our program is a high touch program. We reach families, we go the last mile with every single one of them every other week. And to do that effectively, we have to make sure that we have the information at our fingertips in regards to our key performance indicators. And you can see on the right a very simplistic figure of what our team gets to see or gets to know about the key performance indicators related to the program. We also collect information from our families on, do they like what they're getting? What are their favorite fruits and vegetables? And we analyze all of that information as well, because that allows for our produce procurement team to think about, well, what is it that our families are liking? Are we being culturally sensitive and relevant? And you can see the little bit of a word cloud that we had built on what our families are telling us and what's their favorite fruit or vegetables. And what is nice to see, what was particularly exciting to me as a dietitian to see here, was the variety of fruits and vegetables that our families like out of what we're giving them. So this is just a smattering of the information, but we provide a lot of data. We collect a lot of information on program implementation metrics, and that information is available in real time to our BrightBytes team across all of our 11 cities every single day from every single school, and they can use it to troubleshoot anything that they may need to in real time as well. And this is really critical. The building out this backbone was really critical to answer our next question, which is, are we having an impact? Well, to do that, and this might seem like a very complicated figure, but it's really our conceptual model. BrightBytes was based on, it's theory driven, and it was really formulated on the nutritional science and behavior change as we knew and as we know, 10 years ago when Lisa came to me with the idea And then our team worked on really giving that idea legs and operationalizing the idea and building out the formula. And you can see going left to right, that BrightBytes impacts systems. At the very bottom, you have the organizational level systems that BrightBytes impacts. It impacts schools, it impacts school districts. And then you have the impact that BrightBytes has at the individual level and interpersonal level. So the interaction between a child, between a school, and between the parents, and then also within the family ecosystem, and then the outcomes that we're looking to impact at the very right, which is improve their fruit and vegetable intake, of course, but also improve their the health outcomes of our children and our families. Well, it's important then if you're building out this conceptual model to understand whether it's actually having an impact. And so we've done what we call deep dive research studies. And one of the seminal ones we did back from 2013 to 2015 in about 760 families, we found that BrightBytes significantly increased the amount of fruits and vegetables our children consumed as compared to those who did not participate in BrightBytes. Let me start out by saying that at baseline, before the families participated in BrightBytes, about 70% of them said that they were food insecure, which means they just didn't have enough food to eat on a regular basis. And then children were eating about 1 serving of fruits and vegetables a day. The recommended is 5. So clearly there's a lot of work to be done. And with BrightBytes, we saw a significant increase in the amount of fruits and vegetables consumed. The other nice thing we saw was that there was an impact on reducing the amount of added sugars consumed among the children. And more importantly, that the entire ecosystem of the family home nutrition environment shifted as well, where they were eating more fruits and vegetables as they were being served more fruits and vegetables as snacks. And there was a 2-fold increase in their home nutrition environment metrics, whether it's cooking from using basic ingredients or having more fruits and vegetables as snacks or other home nutrition environmental metrics. So that really was our first deep dive, and we had a comparison group of families who did not participate in BrightBytes. But the part that was particularly important to us as we were starting out at that time was to understand, well, is this sustainable? So we followed the same families from our 2013, 2015 cohort for 2 additional years. And in 2017, we measured what was going on in regards to their fruit and vegetable and were the effects sustained. And what was interesting to me was that we found that not only were the children consuming more fruits and vegetables, but the parent consumption of fruits and vegetables increased even more so from 2015. So a family of 5 was consuming 19 additional servings of fruits and vegetables over a 1-week period, 2 years after participating in BrightBytes. Well, where are they getting this produce from? Clearly, they would have to go to the grocery store to get it. And we translated these effects to the number of families at that point that were in BrightBytes, and there were about 23,000 families, and that's an estimated almost 500,000 additional servings of fruits and vegetables that BrightBytes would have consumed in that school year. And that translates to about $6 million in retail produce sales. So, the whole premise of BrightBytes is how can we create a sustained demand for a product that currently doesn't exist in families that need it the most and who are most vulnerable and in need of fresh fruits and vegetables. And that's sort of what this deep dive research study allowed us to do and track over a period of 4 years. We've also seen consistently in the same research study, we looked at food insecurity. And what we saw that, you can see on the left-hand side at baseline, before BrightBytes started, we saw that families, about 71% of our families were food insecure. And that decreased by about 25% just in 1 year of participating in the program. And what we've seen is that there's a consistent decrease in food insecurity for the number of years that our families participate in BrightBytes as well. So we've seen not just an improvement in their diet quality, but a concurrent improvement in their food security as well. The other part that I wanted to highlight is the systems impact of BrightBytes. BrightBytes has a whole school approach. If you're familiar with CDC, you know that there's a whole school, whole child, whole community approach that's really important to improving child health. And we really have embraced that as part of the work that we do. And what we've seen is that 84%, so our teachers get to participate in the program. 84% of our teachers report that BrightBytes produce distribution influenced their own intake of fruits and vegetables. This was back in 2019, 2020. We've seen consistent results along the same lines. And we collect this data every year from all of our schools. The other thing we've seen is that over 60% of our teachers, now you can see this across several of our cities, said that BrightBytes increased parental engagement at their school. And this is really, I'll tell you guys a story. In one of the initial years that we did BrightBytes was that one of the schools, I think it was Lanier Elementary, did not have a PTO when BrightBytes started. And the principal comes and tells us, because of BrightBytes, they now have a PTO at the school because the program has brought parents into the school. Food is an equalizer. Everybody has to eat. Nobody needs to have special skills to help with bagging and distribution of the produce. We just need parent volunteers. And so we've seen this consistently, again, year after year, of schools telling us that BrightBytes has increased parental engagement at the school as well. So these are a couple of data points in regards to the impact that BrightBytes has at the systems level. We also collect a lot of information. I'm going to stop sharing my screen. I don't know how to stop sharing.
See at the top right corner, there's a stop.
Oh, there.
Yep.
Yes. So I also wanted to share that, BrightBytes is driven by lived experience. We collect a lot of qualitative data from our families that really gives us the roadmap of are we on the right path in regards to our families. And so, I'll share really quickly one of the stories that we've heard, from one of the moms, is that she didn't really buy Brussels sprouts because her family didn't know how to use them. And through BrightBytes, she got Brussels sprouts, and we taught her how to roast them. And her kids loved the Brussels sprouts roasted, so much so that even when they didn't get it through the program, the family would still purchase the Brussels sprouts because her kids loved it so much. So that's just an example of the power of both access and nutrition education in the families that we serve. I'll end on one note in regards to the future and where we are going. While we're focused on children in schools, and that's primarily been our footprint, we are also thinking, we want to meet families where they're at. And one of the important conversations that we've been in recently is the food as medicine conversation of food being potentially a covered benefit. And wouldn't that be exciting if insurance companies would reimburse for food prescriptions? And so in 2022, this incredible pediatrician, Dr. Yeragi, who works at UT Physicians and Harris Health, reached out to me and said that on her own, she has been using our BrightBytes mobile app and website to educate her children and families who've been struggling with obesity. And she said, I'm spending 10 extra minutes each visit with my families to show them these resources, but I don't care. They need it, and I love what BrightBytes has to offer. Can you bring it to our clinics? And so our premise, like I said, has to meet, has been to meet children and families where they are and where they need us to be. So we said yes. And so since 2022, we've been successfully implementing BrightBytes using a home delivery as well as a produce voucher-based prescription program with UT Physicians. We are actually conducting a randomized controlled trial to assess the impact of these on health outcomes. And let me just share that the data shows the need. 7% of these 150 children that we've been working with are pre-diabetic. They're 5 to 12 years old. 15% have high LDL. 22% have abnormal liver panels. 47% have high triglycerides. And 58% have high cholesterol. So clearly there's a need, and we want.
And that's how old, Srila? How old? I mean, how old are those kids?
5 to 12 years old.
I mean, that's insane. Sorry.
Yeah.
That should not be happening in our world today.
And so we're studying the impact that BrightBytes can have on these clinical markers, and huge kudos to the UT physician, Dr. Yeragi, Dr. McKay, Dr. Prabhu, who've been just champions of this work. So, this is a little bit about the data. I wanted to thank everybody for taking the time to be here. Because of the data, we now have the distinction of being a USDA SNAP-Ed approved evidence-based intervention. Recently, we were also approved by the National Cancer Institute as an evidence-based cancer prevention and control program. So we have a model that's impactful, that can be disseminated and is scalable. And the infrastructures and partnerships are in place to do that. So I'll stop there, and I'm happy to answer any questions that folks may have. But thank you for your time.
I think we can all see that she lived up to my intro, that she is the brains behind the organization. But I also appreciate that she puts the information into a format that even I can understand. So I'm grateful. I know that not every professor out there is talented as Srila, both in collecting the data and presenting it. So thank you. There is one question in the chat. It says, can you talk about the data behind the program model to partner with a school for 3 years? And we go in for 3 years and off and back in. Talk just briefly about that, Srila, before we wrap up.
Sure. Yeah. So the 3-on 3-off model was intentional because what we saw in terms of the slope of behavior change is that there was a steep increase in the slope of increased consumption of produce between the first and the second year. And then about second to third year, it kind of plateaued at that high level. And it stayed there. And so, which tells us, and 3 years is a long time for a school to make a commitment to a program like BrightBytes. And it also then allows us to go into more school and spread the footprint. But it's 3-on 3-off, which means that if schools want us back after those 6 years, we'll come back to them. So that's kind of
we have, right? We have.
Yes.
So that's been awesome. But yes, it's really great that we can spread our footprint far and wide with the resources we have. This has been just an absolute delight with all the questions in the chat. You can see that people were really engaged and really appreciated learning more. Tomorrow also promises to be as engaging, but just in a different way. We have school representatives. So it's awesome to hear from us. We like to talk about BrightBytes all day, every day, but let's talk to the people who have actually been impacted. And I think that the school, we love when we get to hear their feedback and their experiences. I was talking to someone just this morning about BrightBytes, and one of our fans it happened to be in the meeting, a friend along the way with Shrila and I that's been working in this arena too. And she said, I can just always tell when I'm at BrightBytes that you treat everyone with respect. And I said, well, I'm so glad that you naturally saw that, because that's a core value. We call it dignity, but it's the same thing. And that we want to treat everyone with dignity as if we would have them in our own home. And that's why we do what we do. So that makes listening and hearing from our school representatives, the people who are always, thank you, Olivier. It's good to see you on there. I see your name. That's so awesome. But it's great to hear from them and their experience. And like Shrila said, whether it's at the school or in the clinic or whatever we're doing, we want to meet people where they're at so we can bring the program to them. So tomorrow you'll hear from them, the actual people that are making it happen with us, the partnerships that we need to make it tick. Have an awesome day. We're so glad y'all are here. And we look forward to partnering more and more. Go to our website, volunteer with us, donate, download our app, whatever makes sense to you. We're just happy to have you part of the team. Have a great Wednesday. Thanks, guys.